Many people at parties will say, "Oh, you're a plastic surgeon," and they'll ask me questions one-on-one. So I'm very comfortable talking about it with people. But many people who've had procedures done are very, very private about things. So it's not typical that I'm talking about things that people have already done in a social setting like this. So this is extremely unusual, and this is because y'all have agreed to come and talk about this because you're comfortable with people knowing what you've done. And so I want to say how much I appreciate it, and thank you for coming here today so that we can have this conversation and share these stories. So I appreciate it.
For me, I couldn't wait to share my story because I think it's important for people to have an opportunity to participate and kind of encourage other people that are on the fence thinking about it. And for me, it was an easy decision. But I understand. I mean, some people don't want anybody to know. Carol and I have a friend that she didn't even tell her boyfriend about it. So she kind of snuck and had it done. And she's waiting for him to catch on and try to figure out what's going on.
Well, her rationale was he's very opposed to plastic surgery.
Right, that's right.
And so since this really isn't what we've had done is all therapy and it's not plastic surgery, she still wants to see. And her, you know, she really thinks that after a while he's going to want to have it done too because he's going to be so impressed. And the reason I don't mind talking about it is because I'm 53 years old, and I am now proud to tell people I'm 53 years old because they don't believe me. You know, it's just been an amazing confidence booster, and I just think it's just, you know, the next best thing to sliced bread for people in our age group, and I just can't say enough good things about it.
As Carol's fiance, I can tell you that I thought she looked great before, but she looks, it's like an improved and fresh version, and it's really amazing. I've mentioned this before, but I'm going to be accused of having a trophy wife here, which is the end result. That's true. But for me, we're already 10 years apart, so if she knocks off 10 years, then that puts us 20 years apart. That was just too much. So you know, and I look over at this lovely lady here. I can't ask you what your age is, but you
It's
know.
okay. I don't mind telling anymore.
Okay. Good.
Yeah, that's right. That's right. A week ago, I turned 51.
Oh my God, that's unbelievable. So you
yeah.
and Carol are about the same age.
We
About the
are.
same age.
Yep.
And it's amazing. You don't mind saying it now, do
I
you?
don't. That's right. I don't. I love the procedure. I think it's wonderful. It's an opportunity for women to be able to do a little something without doing something big and drastic and getting really, really good results.
Carolyn, you are at 90 days
I am.
now, so we've reached the first milestone
Yes,
with that,
yes.
so that's cool. What made you decide to do this?
Well, I had met Carol, and she was very open about telling me about the procedure she had done. She had no qualms about sharing. And I was so impressed because she's a beautiful woman, and she looked extremely young, and without having to have plastic surgery. So that's initially how the seed was planted. And Ray and David are in Rotary together, and when you gave the presentation to the Rotary, Ray had come home and told me about it and had suggested that I possibly would like to maybe have that done, and I had never entertained the thought of having anything done. So, you know, first I was like, you think I need to have that done? But the more I thought about it and the more he encouraged me, I allowed myself to think, wow, that would be really nice to be younger looking, and allowed myself to do that, and with his support, I went ahead and made the decision. 40 years of taking contacts in and out of my eyes have stretched my eyes, so I had a lot of bags, I mean deep bags under my eyes. And I also feel like when I had cancer and I had chemotherapy and 2 surgeries, I feel that that aged me quickly in a short period of time. Not so much that it was maybe noticeable to people, but it noticed, you know, to me, I noticed that it was like a quicker process than it usually was. So the confidence it has given me, and I sometimes walk by and look in a mirror and I'm just like, who is that? And the makeup, I'm using probably half the makeup I typically used to use. In fact, after about 30 days, I put my makeup on one time and I had way too much on and I had to start taking it off because it was just so smooth going on that I didn't need nearly as much. And that was really, really amazing to me. It's been an amazing process, and sharing it with other women like Carol, and now I've met Robin, is just a lot of fun. Cool. Because we're all the same age, basically. So it's
Wonderful.
I'm proud to say I'm 53.
I've been real happy with my results.
And so have I. I mean, it's very subtle. It just, you know, you don't even notice it's going on. And you know, if I think back and look at some of the pictures from a few years ago, it's just totally different.
It's amazing.
And it's wonderful.
Yeah.
Just
It's amazing.
having a 35-year-old wife.
So I have to ask you, Mike, I understand, now you haven't had anything done yet.
I have not had anything done. I've had the before pictures taken, and
We're ready.
And actually, talking to you gives me some encouragement, you know, to do this, and I am looking to just feel better, you know, and look a little better, and nothing drastic, just you know, feel better about myself, about feeling younger.
You were the one who introduced the concept of the procedure to your wife. What are your thoughts about this? How have you felt about all this stuff?
Well, first of all, we got to know David and Carol, and I liked the way Carol looked because I could really see, as a 53-year-old woman, her face was really smooth, you know, and so that was very, you know, very attractive in terms of the outcome of that kind of procedure. Obviously, I've known people who've had plastic surgery where the surgery has been done, and so that looked very interesting, you know, to know that that was done without surgery. So when you gave the talk at the Rotary Club, it was really amazing. The before and after pictures were a big selling point to me embracing the idea to at least just bring it up to Carolyn. So I just thought, you know, I've already got a trophy wife, so let's just keep her. Let's just keep her at that age, and you know, I'll just move on past her, and you know, I can still always point back to how great my wife looks and feel proud of that. And so, I, at this point, don't foresee having the procedure done for myself.
So next week you're going to have the Ulthera treatment done.
Yes.
You were saying that you've had your before pictures done.
Yes.
So we'll have the treatment next week, and then take pictures once a month, and then see what things look like at 90 days.
And
That's the
90
process.
days is kind of the guide, or the milestone that we're looking for.
That is a milestone. That's
Okay.
where, when Ulthera did their studies, they did 90-day studies. And in the patients that we've done, everyone we've done pictures of, you know, that before and after, we've seen some difference at 90 days. It's not like some timer goes off at 90 days and then we're done. We have had a lot of patients, myself included, who've had more changes in that second 3 months as well, which has been really fun. I was joking for a while that soon I'll be 12, which I'm looking forward to very much. But
And where are you in your 90 days?
1 week.
1 weekend.
week.
So you had
It's
the
already-
first
oh, yeah.
thing done.
Just one week,
Yeah.
but it's already noticeable. I mean, I can tell you where it is
that's
around my
really-
jaw. This thing is less here. Under my eyes, more noticeable. Some of the wrinkles around my eyes are less. These things here are not as deep. But the most significant thing for me is what I wanted was kind of more of a neutral face when I wasn't smiling and talking. And what was happening is I was starting to get this, you know, and I get a little, it depends upon where I'm sitting in the light and everything, but right now my neutral smile is almost horizontal, which is, I don't mean to say smile, but my neutral position on my lips is almost horizontal. I actually had a guy say this to me, it was actually quite a few years ago. He said, cheer. I didn't even know who he was. Walking down and said, hey, just cheer up. I didn't know what he was talking about, but apparently he saw this frown and I must have looked like I was unhappy. That obviously made an impression because I still think about it. And that always bothered me. So I'm 1 weekend and I'm already feeling good about it. Real good.
Yeah, because those are the same things I'm looking for. A little deep here, a little starting to get turkey neck or whatever they call it, you know, starting to get real loose here. My eyes are starting to droop a little bit, which is I guess what Meghan will take care of for me.
If you've seen any of our videos before, then you know that Robin is my esthetician in Statesboro, and so she's done some of these procedures. She does the Ulthera procedure as the technician doing it. And so, Robin, I want to ask you, what made you decide that you wanted to have it done yourself?
Well, initially, Dr. McGovern, you know, during training and stuff, and you know, doing the procedure on other people and seeing the results that were just
Good. We're going to turn the other way,
amazing to me, and they are very subtle, but at the same time, they're big changes, and it was just nice to see those changes in other people, and of course, I wanted that for myself.
You know, women our age
Right.
can have these things and
Right.
just feel good about ourselves, and
Yep.
and it's all, I'm sure even when you're working on these procedures with patients, you can give a personal perspective
Right.
of how it
Right.
affected you, and that's also
Right.
good for them, because you did that to me.
Right.
You were the one that did the procedure for me.
Right.
And you kept telling me, okay, and you walked me through it and
Right.
telling me what was going to happen in the future, and just made me very comfortable through the whole thing.
Right.
So I thank you for that.
Yeah.
But she also you have a before and after picture in your office.
I do.
right?
I do, and
it is
that's amazing. Yeah, it is amazing.
And the first picture that I show all my patients is my before and after, so they know
Right.
where I'm coming
Right.
from with it. I've had it done.
Right.
When we, you know, I've evaluated, I can't tell you how many machines have passed through my office that I've looked at, and I make them make me want to buy it. So they made me want to buy it.
Well, and as your
So-
esthetician, Dr. McGovern, and talking with women every day, women my age, you know, within this age group, and you know, feeling what they want, the changes that they're looking for, you know, the subtle changes that the same as me, the same feeling as me. We want to do something. You know, you want to improve things, and you want to do something without doing something that's going to put you out of commission for a long period of time.
Sure.
It's not going to give you a lot of downtime, but you're really going to be able to see and notice the change, and it does make you feel so good about yourself. For me, to be able to explain to these women and show them my before and after pictures, and then to see their changes is just unbelievable. I love it.
And it's great because you didn't want to be 18. You know,
Well, that
you're
might
50.
not be so bad.
but
Right,
you know, you're
right.
50
Just
and
want to
wanna
look your
just
best, yeah.
look good
Yeah.
and look 30-ish, 35-ish or
Well,
whatever.
I just wanted to look the best I could for my age, you know.
And one thing I would like to add too is what Robin said. For a lot of women who work, who have a demanding job or work outside the home, the thought of having plastic surgery and being down, I couldn't be down more than a day and a half. I mean, you know, because we work in the public and we are very social and we're very active in the community, and that would not even be an option to have any plastic surgery. So that was the thought of being in and out in an hour and a half with no signs of having anything done physically was just, that probably sealed the decision for me.
Like I said, the first picture that I show patients is the picture of myself. I've had it done, and I can explain to people what it feels like and the process and what to expect afterwards from a personal standpoint and a professional standpoint. And as my esthetician, since you've had it done, you can do the same thing, and it provides a level of comfort. Yes, we have the technical experience, we've been trained how to do it, we're very cautious and careful and all those things, but also we know what it feels like.
That's
and
right.
we know how to help you through it because we've experienced it as well. And I think that that can only add to a patient's confidence and comfort level, knowing that they're going through this procedure, and we understand, we know where they're coming from, and we can help them. Now you're at 90 days, and we typically do before and afters at that 90-day mark. I have many patients who are doing other things, not everyone, but other people who are doing Botox or Dysport, so they'll be doing that every 4 months or so, 4 to 6. Other people are doing other procedures for their skin or for their faces. So I've seen a lot of patients after that 3-month mark. But from an Ulthera standpoint, we're done in terms of the follow-up and that kind of stuff, unless you desire to do more things or show. I'm always happy to see you. I'd love for you to come back at 6 months and say, woohoo, it's even better. You know, those kind of things. But traditionally what we've done with patients who are just doing Ulthera right now are seeing those 90-day results. And then if you ever desire to repeat this treatment, once you've achieved your 90-day results, you could do it again. You don't need it. You look gorgeous. But we've had patients who've repeated the treatment at 6 months out or those kind of things. Most people repeat it about every 2 years. Not because all of it has gone away. It usually lasts about 5 years. But we can, with very little downtime, an hour and a half in and out, we can stack those results and expect more tightening when patients repeat it.
If a woman didn't want to have the complete procedure done again after a couple of years, would it be possible just to have, let's say, your eyes done or just your chin done, just a partial? Okay.
I'm glad you asked that. I was going to ask that. You look gorgeous, by the way.
Oh, thank you very much. I appreciate that.
Really
I feel good. Thank you.
Ray, my husband would be so against me having anything, or has been against me having any procedure. I had to really talk him into it. For you to go home and suggest to Carolyn she had it is just very
just
supportive.
This blank check.
Well, yeah, I mean,
Whatever, honey.
I'm so impressed. I'm so impressed. But did you really have to push her into it?
No, not really push. I think the fact that I suggested it was enough of a motivation for her to go ahead and take the chance. And,
take the carrot.
Yeah, take
What
the
a wonderful
carrot.
husband, obviously.
I do.
Just to answer that question more fully, it is absolutely possible to do segmental treatments. You don't have to do the whole thing. So if you got to your result, or next year or whenever it made sense to you, if you start seeing some changes around your eyes, spot treat around the eyes, no problem. Or just on the brow, or just on the underside of the chin. And a few minutes ago, you asked me if many men have done this. A very common area of concern for the men is this area through there. So we've had some men that, because they have more change there than other places, we've actually planned to do a dual treatment of the underside of the chin. So we've done the full face on the first pass, and then 3 months later we've come back to further tighten the jawline for people, and that's worked very nicely for when people have real trouble spots and that kind of thing. But we've done more and more men.
Actually, you talked about how you were impressed with Carol. One of the ways that I got my husband to agree, because I think he was scared of having a Barbie doll, that's what he said anyway, was we all went out to dinner, and he is the same age. My husband's 53 as Carol is. I always say he's much older than me, but it's only really 7 years. And he said, so you're about Leslie's age or younger? And she went, no, I'm 53. No, you weren't born there. I'm 53. Well, that was the clincher. Next day, I'm allowed to go and see Dr. McGovern. So thanks, Carol. And, you look wonderful. And I will think about Ulthera maybe, but I just had such a great experience with my fillers. And, we'll work together. And I know we can always talk and adapt the treatment as I need it. So.
Absolutely. And that is really an important part, an important point. Every person is coming in with their own specific ideas about and their own specific goals. If I had identical twins come in who had aged similarly, they might pick different things to start with. Everybody has something that really bugs them in the mirror, and there are different ways of addressing each component of the aging process. So Ultherapy may make sense to you at some point. It may not. Yes. Restoration of volume is a component of aging. We lose volume in specific areas as we age. Each person is unique in that process as well. And we're addressing different components with each one of these treatments. And the one that makes sense to you and really clicks with you is usually the right answer. I'm going to help guide patients through that process, and I want to find what's really inside your head and what's really going to make you the most happy. But each person is an individual. And sometimes the right tool to accomplish the goal that patient has is surgical. And we're going to step back and say, I'm a board certified plastic surgeon. I love surgery when it's the right tool. I just know that aging of the face is not just extra skin. It's not entirely fixable with just a facelift. And we have so many tools available that really address the underlying things that cause us to look older than we want to, that don't involve a knife. and it really allows patients who don't have a comfort level with the knife, like you, it allows you to achieve the goals that you're looking for without the negative consequences that people perceive with surgery.
And that was so important to me. You really listened to that, because I have a fear of the knife because of what I've had to go through in my life surgery, which was necessary and has saved my life, but actually not to volunteer for going into life. You completely understood that, and that was so important to me. And my husband's very protective about, you know, nasty procedures, so he's very comfortable with what we do. And the fact you treat us as people, not just patients, is just so important.
Contact Dr. Meghan McGovern at Coastal Empire Plastic Surgery today to learn more.